If you are over 70 years old and your doctor is pushing your blood pressure down to 120/80, that goal might be the most dangerous prescription you have ever received. Yes, you heard me right. For decades, medicine has drilled one message into our heads: lower is better. Get that number down, add another pill, cut more salt. Push, push, push that blood pressure as low as it can go. But new research from some of the most respected geriatric institutions in the world is sounding an alarm. For seniors, forcing blood pressure too low can cause devastating falls, permanent brain fog, kidney failure, and yes, even a shorter life. The truth is, your body after 70 needs a different number. Not too high, not too low. It needs the Goldilocks zone, the pressure range that protects your heart without starving your brain. Today, I am going to show you exactly what that zone is, how to test yourself at home in 2 minutes, and the one sentence you need to say to your doctor at your next appointment that could save your life. Let me explain why the standard advice is failing millions of seniors. 120/80. That number was established based on studies of middle-aged adults, people in their 40s and 50s with flexible, elastic, healthy arteries. But your arteries at 70, 75, 80 years old, they are not the same arteries you had at 30. They have stiffened, they have narrowed, some of them have calcified. This is a natural part of aging, and it happens to everyone, even the healthiest people on Earth. Now, here is the critical point most doctors do not have time to explain. Your brain sits at the very top of your body. Blood has to travel upward, against gravity, through narrowing, stiffening arteries to reach it. To push blood through those aging pipes and up that hill, your body naturally raises the pressure a little bit. It is not a malfunction. It is an adaptation. It is your body being smart. Think of it like a garden hose. If the hose is wide and flexible, gentle water pressure is enough to reach the flower bed at the end. But if the hose is old, partially kinked, and half the diameter it used to be, you need to turn up the faucet. Otherwise, no water reaches the flowers. Your brain is the flower bed. Blood pressure is the faucet. When your doctor prescribes aggressive medication to force that pressure down to 120, they are turning the faucet too low. The water is not reaching the flowers. Your brain is not getting enough blood. This has a medical name. It is called cerebral hypoperfusion, literally underfeeding your brain. And this is exactly why so many seniors on blood pressure medication experience dizziness when they stand up, confusion in the afternoon, memory problems they blame on age, fatigue that never goes away no matter how much they sleep. It is not aging. It is not dementia starting. In many cases, it is their medication starving their brain of blood. A pivotal study published in the Journal of the American Medical Association Internal Medicine in 2015 analyzed over 4,600 adults over 70 years old. The researchers found that patients whose systolic blood pressure was pushed below 130 had a significantly higher rate of serious falls compared to those maintained at 130/150. More falls, not fewer. Let that sink in. The treatment was causing the injuries. This phenomenon has a specific clinical name, and I want you to remember it because it could save your life, or the life of someone you love. It is called orthostatic hypotension. Ortho, standing. Static, position. Hypotension, low pressure. Here is what happens. You are lying down or sitting. Blood is evenly distributed. Your brain is happy. Then you stand up. Gravity instantly pulls a significant volume of blood, roughly 300 to 800 milliliters, downward into your legs and abdomen. In a younger person with elastic arteries and responsive baroreceptors, the body compensates in less than a second. Arteries tighten, heart rate increases slightly, pressure is maintained. You do not feel a thing. But in a senior, especially one on 2 or 3 blood pressure medications, this compensation system is sluggish. The arteries are too stiff to tighten quickly. The medications are actively preventing the heart from speeding up. And the baroreceptors, those pressure sensors I talked about in my pressure button video, are often degraded. So you stand up, blood rushes down, and for 5, 10, maybe 15 seconds, your brain gets almost no blood. The room spins, your vision narrows, your legs buckle, and you fall. Now, let me tell you why this is not just an inconvenience. Let me tell you why this terrifies geriatric physicians. A hip fracture in a person over 80 years old carries a 1-year mortality rate of approximately 20 to 30%. 20 to 30%. That is comparable to many cancers. 1 in 4 people who break a hip after 80 will not be alive 12 months later. Not from the fracture itself, but from the complications. Pneumonia from bed rest, blood clots from immobility, infections, loss of independence that leads to rapid decline. A landmark study published in The Lancet in 2019 examined over 1 million older adults and found that orthostatic hypotension was independently associated with a 28% increased risk of all-cause mortality and a 36% increased risk of heart failure events. So let me say this very clearly. Overly aggressive blood pressure medication in a senior can be just as deadly as the high blood pressure itself. Perhaps more deadly, because a stroke from high pressure is a possibility, but a fall from low pressure is a near certainty if the medication is wrong. So what is the right number? What is the safe zone? This is where medicine has been evolving, and I want to give you the most current thinking based on the latest geriatric guidelines. For adults aged 60 to 70 who are otherwise healthy and active, a systolic target of 130 to 140 over 80 to 85 is considered optimal. This is slightly more relaxed than the old 120 over 80 rule, and it gives your brain adequate perfusion while still protecting your heart. For adults aged 75 and older, especially those who are frail, take multiple medications, or have a history of falls, recent guidelines from the European Society of Hypertension, updated in 2023, suggest that a systolic target of 140 to 150 is not only acceptable but may be preferable. Let me repeat that because it contradicts everything you have been told. For a frail 80-year-old, a blood pressure of 145 over 85 might be the safest number, safer than 120, safer than 115. Significantly safer than 110. A critically important study published in Age and Aging, the official journal of the British Geriatric Society, in 2020 reviewed blood pressure targets in adults over 80. Their conclusion was striking. They stated that in frail elderly patients, a systolic target below 130 offered no additional cardiovascular benefit, but significantly increased adverse events including falls, syncope, electrolyte imbalances, and acute kidney injury. No benefit, increased harm. Those are not my words. That is the British Geriatric Society. And here is something even more nuanced. A study published in the journal Hypertension, the official journal of the American Heart Association, in 2021, analyzed data from the famous SPRINT trial. They found that while intensive blood pressure lowering to below 120 did reduce heart attacks in the overall population, among participants over 75, the intensive group experienced significantly more episodes of dangerously low blood pressure, fainting, falls, and electrolyte problems. Your brain does not care about textbook numbers. Your brain cares about blood flow. And your brain prefers stability, a steady, consistent pressure, over a number that looks perfect on paper but leaves you dizzy every time you stand up. Think of it this way. A river that flows steadily at a moderate level nourishes everything along its banks. A river that is constantly being dammed and released, it destroys the banks. Your brain needs a steady river, not a roller coaster. Now, here is the most important part of this video, your homework. I want you to do what I call the stand test, and I want you to do it tonight. This is a simple 2-minute test that can tell you whether your current medication dose is putting you at risk. Step 1. Lie down on your bed or couch. Get comfortable. Rest for 5 full minutes. Do not talk. Do not look at your phone. Just breathe and rest. Step 2. While still lying down, measure your blood pressure. Write down the number, both the top number, systolic, and the bottom number, diastolic. Also, write down your heart rate. This is your baseline. Step 3. Now stand up, carefully holding on to something stable. Set a timer for 1 minute. At exactly 1 minute of standing, measure your blood pressure again in the same arm. Write it down next to the first number. Step 4. Now, compare the two numbers. Here is the critical threshold. If your top number, systolic, drops by more than 20 points when you stand up, or your bottom number, Diastolic drops by more than 10 points. You have orthostatic hypotension. For example, if your lying pressure is 142 over 84 and your standing pressure is 120 over 72, that is a systolic drop of 22 points. That person has orthostatic hypotension. That person is at risk of falling. Now, step 5, and this is the most important step of all. If you fail this test, if you see that drop, I want you to write down one sentence and bring it to your next doctor's appointment. Here is the sentence. Doctor, I did a lying to standing blood pressure test at home, and my systolic dropped by more than 20 points. I believe I may have orthostatic hypotension. Can we discuss adjusting my medication? Say it exactly like that. Clear, calm, factual. You are not demanding anything. You are not arguing. You are presenting data, your own data, and asking for a conversation. Most doctors will respect this enormously. They will take you seriously. And in many cases, they will agree to reduce or adjust your medication, perhaps lowering the dose, perhaps switching to a gentler drug, perhaps eliminating one pill entirely if you are on multiple. I also want you to do this test at 2 different times, once in the morning before your medication and once in the evening. Many seniors experience the worst drops in the late afternoon or evening when medications are at peak effect. Bonus step: if you want to be truly thorough, do the test 3 days in a row and average the results. Blood pressure fluctuates naturally, so multiple readings give a much more accurate picture than a single measurement. Now, I must be very clear about something. I am not telling you to stop your medication. I am not telling you that high blood pressure does not matter. It absolutely does. Uncontrolled hypertension, systolic above 180, 190, is an emergency at any age. What I am telling you is that the target number matters. And for seniors, especially frail seniors, that target should be individualized, not pulled from a chart designed for 50-year-olds. The goal is balance, the Goldilocks pressure. Not too high, not too low. Just right. For you, for your age, for your body. So let me ask you directly, and I really want to hear from you in the comments. Have you ever felt dizzy when you stood up? Have you ever grabbed a wall or a counter because the room started spinning after getting out of bed? Have you ever fallen and been told it was just your age? Tell me your story. Tell me your numbers. I read every single comment, and your experience could help someone else watching this video realize that their dizziness is not normal aging. It is a fixable problem. And if you want to go deeper, if you want to learn how to make your stiff arteries softer and more flexible so your body can naturally maintain the right pressure without as much medication, you absolutely must watch my next video. In that video, I show you how to rebuild the microscopic protective lining of your arteries using 3 specific foods and 1 free daily habit. Hit subscribe, share this video with every person over 70 that you care about, because the truth is, your body is not broken. It is adapting, and sometimes the bravest thing you can do for your health is tell your doctor, not too high, not too low. Give me the Goldilocks pressure. I am Dr. Mary. Take care of your heart, and it will take care of you.